CAHN, the Caribbean and African Health Network. So we're joined by Peace, who is the Health and Wellbeing Development Manager, who's going to be leading the session today. And this session is around the Knowledge Access Screening for Improved Health project, empowering the Salford African and Caribbean community for heart health. So if anyone has any questions throughout the session, please do put them in the chat, and I'll pass over to Peace now. Thank you.
Yeah, thanks for the introduction. I'll put up my slide now and begin with the presentation. Can I just confirm that you can see my slide, please?
Yes, it's not in. Yes, there we go. It's full screen now. Yeah.
Oh, brilliant. Thank you. Yeah, good morning once again, and thank you so much for taking our time to be part to join in the webinar today. It's been a series on mobilizing the Black community for improved health and well-being. And then today's focus is on the KASIH, which Ilse introduced earlier, which is knowledge access screening for improved health. And then the focus is on empowering the Salford, Caribbean and African community. So it was a project that we ran in Salford and was successful. Just want to talk you through the aim, the objectives, and what we also do at CAHN. Yeah, so before I go into KASIH and what the project was about, what we achieved and all of that, I would just want to talk you through our vision, our mission, objectives, and some of the other projects we do in our organization. So CAHN, Caribbean and African Health Network, our vision is to eradicate health inequalities and wider disparities for Caribbean and African people in a generation. And our mission is to ensure that the strategic and operational actions of service providers across health and cross-sector agencies and commissioners lead to racial and social justice for Black people. And then in achieving that, we have 4 objectives, which is to work collaboratively with Caribbean and African faith and community organizations, strengthening their structures, systems, so that they can respond and then meet the needs, the health and well-being needs of people in the community. And also in terms of partnership, so partnering across sectors to be that point of contact between the community and voluntary sector organizations and then commissioning agencies, and also to engage in continuous consultation, planning, evaluation to provide solutions to persistent health inequalities and act as that direct point of contact with commissioners. And lastly, to champion the work of the Caribbean and African community by promoting its assets, efficiencies, and achievements. So why was CAHN set up? CAHN started in 2017 under the back of our chair's PhD. And then why we were set up? So yes, there was a problem. Around this problem, there's poor access. So for people in the Caribbean and African community, accessing healthcare, and there was that underlying and historical issue of lack of trust. So not trusting the healthcare system for various reasons. And then poor engagement. So we're being termed as the hard to reach group, but in the real sense, it's just how well our community, people from our community are engaged. So there's that poor engagement and there's that inadequate knowledge of research. So yes, we know that there are bits and bobs of research around, but then there's limited research on health conditions related to Black people. And then there's that bias of structural system processes and practices. So yeah, CAHN was set up to address some of these issues. There's that in terms of structural barriers, decision-making and representation, not having people from the Black community well represented in decision-making rooms. There's also that barrier of benchmarking to majority population, so just generalizing everything. But then in terms of like the BMI and some other things that are more specific to people in our community. Also racial discrimination, unconscious and conscious bias, community engagement and investment, especially in the faith sector. Like I said in the last webinar, most people from our community are more like faith-based, so either being Christians or Muslims or other faiths. But then there's that little or very little investment in the faith sector as a whole. So in terms of our area of work, we have different departments. So on my screen, you can see we have community empowerment and advocacy, issues around immigration status, immigration, housing, health conditions, just having people to support and advocate on their behalf. So we things around that are being treated or addressed in that department. And then we have our health and wellbeing service programs and initiatives. On my next slide, I'll be showing you some of these service programs and initiatives under the health and wellbeing remit. We have education, training, leadership, and development. We have our infrastructure and capacity building team. And we also have research and innovation that is seeking to address the problem of lack of research in our community. And also we have on my right, we have our corporate affairs unit, which covers the finance, people's team, IT team, the business development and sustainability team, comms and marketing, and then corporate delivery and compliance. Yeah, so this slide talks about some of our service programs and initiatives that we have in CAHN. So we have our counseling services that addresses day-to-day lifestyle issues, mild mental health conditions, and then severe mental health conditions, also bereavement issues. And we also have befriending as well. The hospital discharge service is to offer practical support to Caribbean and Africans due to be discharged from hospitals to settle well in their homes. So we offer practical support like grocery shopping, prescription collection, house cleaning, and providing hot or cold meal. And then as well, within the first 3 to 7 days of referral, we offer well-being checks. Depends, it happens on a case-by-case basis. So some would be over 7 days and some is within the project's offer. And we also have a Black Community Health Forum across some of the localities in Greater Manchester, where key leaders from the community meet to talk about some of the challenges that people in community are facing and how they could work as a whole to address that. And with CAHN being the key point of contact. And then, yes, I'm talking about knowledge access screening for improved health today, which is KASIH. We also have our harm reduction initiative, and we have a Call 20+5 Community Connectors program. We have a Living Well program, Green and Nats Wellbeing Service program, and then physical activities outreach. Under that remit, we have a boys club, and then girls clubs, not just physical activities, but then the holistic, taking a more holistic approach. So whilst engaging young people, and then I think there's another one dedicated to older people. So while engaging them in physical activities, we also kind of bring or imbibe other areas of what we do. So for example, the times when they have green and arts wellbeing workshops or empowerment workshops, just to whilst they're improving their physical and mental health, other areas of their life are also improved, and then they acquire skills. And then lastly, the health screening outreach program, and then the weekly health webinars, which is KASIH and the Healthy Hearts. I'll be talking on better on that in the next couple of slides. So in terms of improving health literacy, which is one of like the key priorities for CAHN, we have on Saturdays our Caribbean and African Targeted Health Improvement Program, KATIP. We started in May 2022 during the pandemic. Since then, we've been live on Zoom every Saturday, on Zoom, on YouTube, on Facebook, and I think on Instagram as well. And then it's hosted by volunteer CAHN medical lead and other clinicians. And we have like Black clinicians, GP consultants, and specialists that come on board to talk about health conditions that disproportionately affect people in our community. So there's that 40 to 60 minutes presentation on a particular health topic, and then it's followed by a question and answer session. And after, people are then given the opportunity to ask questions, get clarifications on concerns. And then afterwards, there are opportunities for follow-up one-to-one consultation. So this is on every Saturday from 11 a.m. to 12:15 p.m. And then also in terms of health literacy as well, we have another webinar session that goes on every Tuesday. I think yesterday's session was on physical activity and diet. And so it takes place by 6:30 p.m. to 7:30 p.m. to I think 8 o'clock. So for the first 1 hour, there's that presentation where we have Black nutritionist or dietitian coming to talk about diets, nutrition, healthy lifestyles, and some health conditions, and how like your diet or your nutrition affects your health. And also it's followed by a 30 minutes physical activity led by our physical instructor in CAHN. And I'll say over the years, we've had like very positive feedback, people being more culturally aware of themselves and also health conditions. And then in terms of like the healthy heart sessions, people who maybe were diagnosed with diabetes coming out of it and then improving and modifying their lifestyle. So these are some of like the health art topics we've had in the past. For CAHN is about improving health literacy, culturally appropriate community service provision. And then you can see just this is just over the years on Zoom. This is the statistics of people we've had. I think this was last year. We had about 6,300 6,037 attendees in total on Zoom. Okay. So I'm talking about knowledge access screening for improved health today and how that's worked, how we're trying to empower the Salford Caribbean and African community. And we're hoping to replicate this in other boroughs in other localities in Greater Manchester, and then to also take it nationally. The context of CVD. So each year, cardiovascular disease costs the economy 22 billion, and over 7 million people are living with cardiovascular disease. The cost of Black people with CVD is unknown. However, we know that Black people in the UK are twice more likely to experience cardiovascular disease-related conditions and at a younger age than the rest of the other population or other ethnicity. So the objective of KASIH was raising awareness of CVD in the Caribbean and African community in Salford, and interventions focused on how we address already existing disparities exacerbated by the COVID-19 pandemic, and then culturally appropriate messaging and engagement. So in the next slide, I'll be talking about the aim. How did we want to achieve that? So this uniquely innovative project was designed to increase the health literacy of community members. So it was to increase health literacy in 1,200 people in Salford. That was our target. And then to screen a minimum of 500 people, health screening, and then to train 12 health ambassadors from the community. I think my next slide breaks it down more. So in terms of like the 12 health ambassadors, we had they're comprised of people from the community, faith leaders, people who own businesses in the community, hairdressers and barbers. And then the approach was to get them on board, take them through a series of training, what cardiovascular disease means, management, prevention, and how to have culturally appropriate conversations with people in the community around cardiovascular disease. So people who struggle to take their medication or don't understand the importance of taking their medication, how could maybe a faith leader convince people, people from his or her congregation about maybe taking their medication, modifying their lifestyle, healthy eating, going for their blood pressure checks, and all of that. So it was just creating that awareness and empowering them to keep spreading the word. So whilst they were undertaking the training, I think it was an eye-opener to majority of them. So it made them more aware about these health conditions and how they could, first of all, manage themselves and also spread the word to people in the community. So like I just said, maybe a pastor being aware of cardiovascular disease prevention and management, and then how he would then be able to like spread that word to people in his church and it's his family, a hairdresser or a barber while doing their job, barbing, maybe cutting someone's hair during the day, just having conversations with them about their lifestyle, blood pressure checks, when last did you see your GP, things around that. And then for very critical conditions or people who have issues with trust and find it difficult to actually go into the GP. So how do you convince them, or how do you talk to them from a cultural perspective, encouraging them to see the importance of actually taking this seriously, probably going to see their GP to check their blood pressure, and if they've been diagnosed with hypertension, would it be having to take medication or having to modify their lifestyle? So in terms of health education, like I said, just on the back of the KASIH and the Healthy Hearts, so KASIH every Saturday and Healthy Hearts every Tuesday. Over the years, we've actually created health awareness and educated people on cardiovascular disease and prevention, the barriers, blood pressure screening in churches and communities. So we have volunteer nurses going into spaces, community spaces to screen, so checking people's blood pressure, atrial fibrillation, glucose level, and then if there is any hypertension case finding, referring them to quickly go into their GP to address that. And we've actually had people who said, oh, I'm really grateful for like the nursing screening because it saved my life. So not if maybe, for example, I'd not maybe come for this screening, I wouldn't have known that I was hypertensive or I was diabetic and all of that. So it helped them quickly modify their lifestyle before it became worse. So that's what we talk about, prevention and then management as well. Yeah, so this, I think when we're recruiting for the health ambassadors, this is one of the flyers that we set up and then circulated to get people from the community. So just quickly to buttress like what we do for KASIH, I would like to play, I think it's a 5 to 6 minute video. Can I check that you can hear my sound, please? Yes.
I can hear
Okay.
you, but I'm not sure if I can hear the video sound. No, I can't hear the video sound.
I can hear the video sound. Okay, let me just stop sharing and share again,
Yeah, and then
please.
reshare with computer
Yeah.
audio, yeah.
Can you hear me now? Can you
Yes, I
hear
can
it
hear it
now?
now.
We decided to bring together groups of nurses, doctors, pharmacists, nutritionists, physical instructors. We brought them all together. We took our army of people and we went around churches and we went around community centres and we did screening. And we have screened, and I wrote the figure down, and I think it's almost 4,000 people since 2017. We have screened.
I'm glad I went to this program He teach me a lot, as well as in my family, in my personal life as well. My family, they suffer a lot with high blood pressure and diabetes, and they don't take anything until the end that they've been ill. They're sitting down, they can walk and everything, and there's no enough time to treat it. So everybody who's gone in my family is just diabetes, high blood pressure, diabetes, high blood pressure. So this gave me a really good platform and opportunity to teach my family as well.
And I'm really, really grateful to CAHN for giving me this opportunity. And also I'm very grateful to John, who has always been looking after me, who has always made sure that I don't miss the Zoom trainings. Peace for keeping asking me, how are you today? How are you doing? Every time I lag behind. So I'm really grateful to CAHN for organizing this. And I intend actually to give 5 to 10 minutes to cardiovascular health issues in every meeting that we have at Eritrean community meetings from now onwards.
Again, we're a community whereby we believe in everything's faith. There are things we don't need to pray about. We can manage by ourselves. So KASIH has been a part of it's been a part of me that is impacting life around me. I've learned a lot from the lessons we had. When John told me about KASIH project, I was excited in the spirit, because not only that I'm a pastor in the church, I work in the community. I have done church pastoring, and also I work with people in a homeless situation. So I see life events, I see people suffering from ill health because of partially what they eat. They are causing, they're part of the problem. So, but due to you don't have enough information, you are limited in knowledge on how to deal with that area. So we resort to prayer and fasting, and I'm being real. So, but the fact that I get involved with CAHN, get involved with KASIH program, where I was able to be empowered and informed. And now I'm using the knowledge I've acquired from the training to impact people around me.
I meet a lot of people from my barber shop, and through this training, I've learned a lot about my well-being. I've learned how to manage my blood pressure, my salt intake, my fat intake, healthy living, healthy eating, and everything. And I want to use this platform to help my community, to help the people around me. I've recently lost 2 of my friends through cardiovascular disease, and I want to use this platform to let people know that they should be able to look after themselves well, to take it serious, because this is a silent killer. We've learned a lot here. I've met different people, and we share a lot of experience, and which I want to share with people. So I will now be streaming it live on my shop every Saturdays morning. I'll be giving leaflet out and educating people about this issue.
But most of our people, they are depressed. They could not think, about healthy cooking. And I just open up their mind, whatever they have got in their hand, to cook in right way. Because personally, also I'm a chef. And also, since I learned about a lot of courses, training, just informing them. We at least 2 or 3 times a week I work with health improvement team. We're running women and children. Men, I organize, they play football. Children also at the same time they do cricket and rounder.
So CAHN has really helped us, giving us the opportunity to hear from other people, and these are the knowledge we are trying to pass to our own community. In our own church, we have monthly meetings regarding health. In both, we have for the singles, we have for the married, so that we'll know the exact thing that you need as individual. And one thing that pained me most recently is a friend of mine that passed away not long ago. And what happened? He had an accident, and he just assumed that he would be fine. And some months later, he died, because he refused to go to the hospital and let them help him. So these are the things that we should try and press more into our community. Don't shy away from it. Come to us, speak to people, let them understand what the pain and where the pain is, because if you don't speak, you will die silently.
Primary care services are at where they're at, and I suppose we've got to come together as a community to make a difference, because if not, nothing's going to change. And it's great projects like this that start that process of change. So it's great to hear from many communities that I can see around the table here today. So just want to say thank you very much for all the hard work and dedication that you've done for this programme.
So massive thanks everyone, and it's a real delight, and I hope your journey hasn't come to an end. I like the different expertise, including the BAV. You would have many people, whom will come to you, and they will trust you. And it's that trust you have, whether in the church, in your sphere of influence, that is what we want to harness, so that it's not one person being a gatekeeper, but collectively we can influence and have a wider reach. So massive thanks for all you've done. And although certificates are being issued today, I'm hoping that, the team can follow up with some, little talk.
Yeah, this is just a picture of the health ambassadors, I think, after the celebration events. And then I've come to the end of my presentation. Any question?